High blood pressure has long been considered the silent killer and is one of the leading causes of cardiovascular diseases, strokes, and kidney failure. For years, the medical community has debated a crucial question. What is the ideal blood pressure level? Is lower always better? This remains a controversial topic, with no unanimous agreement among experts. At the beginning of the program, the doctor raises the question, should blood pressure be lowered below 120/80 mmHg? This is a level often considered the gold standard for heart health, but not everyone agrees with this perspective. For decades, medical professionals have been striving to determine the optimal blood pressure level to minimize cardiovascular risks. However, recent studies have questioned whether lowering blood pressure too much is truly beneficial for everyone or if it might lead to unwanted side effects. The doctor shares that he has spent over 25 years teaching and researching blood pressure. Throughout his career, he firmly believed that maintaining blood pressure as low as possible was a beneficial approach. However, in recent years, he has started to question this belief after reviewing new studies. Some research suggests that excessively lowering blood pressure may not provide significant benefits and could even pose risks for certain patient groups, particularly the elderly or those with underlying health conditions. This has led many experts to reconsider previous treatment guidelines. One of the biggest challenges in medicine is the constant evolution of treatment guidelines. Global health organizations, such as the American Heart Association (AHA), the European Society of Cardiology (ESC), and the World Health Organization (WHO), frequently adjust their recommendations for ideal blood pressure levels based on the latest research. For instance, before 2017, a person with a blood pressure reading of 130/80 mmHg was still considered to be within the normal range. However, in 2017, the AHA redefined high blood pressure, lowering the threshold to 120/80 mmHg. This meant that millions of individuals who were previously classified as having normal blood pressure suddenly became hypertensive overnight. Not only the AHA, but also other health organizations have continually shifted their stance on blood pressure levels. In 2003, a blood pressure reading of 140/90 mmHg was considered acceptable, but by 2017, the benchmark had dropped to 120/80 mmHg. By 2022, some studies began questioning whether such a low target should be maintained. This constant shift has left many people confused, raising concerns about whether these adjustments are genuinely based on scientific evidence or if they are influenced by pharmaceutical companies funding the research. The biggest issue with these guidelines is their one-size-fits-all approach, while in reality, every individual has different health conditions. A young and healthy person might tolerate lower blood pressure well, but for an elderly individual, excessively low blood pressure could lead to dizziness, fainting, or even strokes due to reduced blood flow to the brain. Therefore, instead of applying a fixed number to everyone, we should consider each case individually, taking into account factors such as age, underlying conditions, and the body's response to treatment. In the following sections, the doctor will delve deeper into the latest research, discuss the risks of excessively lowering blood pressure, and provide recommendations tailored to different groups of patients. So, should we lower blood pressure below 120/80 mmHg? Let's continue exploring. Blood pressure control has always been a critical topic in medicine, as high blood pressure is considered one of the leading causes of death worldwide. However, a major question arises. To what extent should blood pressure be lowered? Is lowering blood pressure as much as possible truly beneficial? This is an issue that medical experts need to carefully reevaluate. In the past, most doctors agreed that the lower the blood pressure, the lower the risk of cardiovascular disease. This led to treatment strategies aimed at bringing blood pressure down to 120/80 mmHg or even lower. However, recent studies suggest that this approach may not be entirely correct and, in some cases, could even be harmful. A 2022 study found that not everyone should lower their blood pressure to extremely low levels, especially the elderly or those with complex underlying conditions. Excessive blood pressure reduction may lead to risks such as dizziness, falls, kidney dysfunction, and even an increased risk of ischemic stroke. This suggests that rather than applying a fixed blood pressure target for everyone, Treatment should be more flexible and tailored to individual health conditions. One of the most influential studies on blood pressure management is the SPRINT trial. This study was conducted to determine whether lowering blood pressure below 120 millimeters of mercury could reduce the risk of cardiovascular disease and mortality. The initial results suggested that aggressive blood pressure reduction significantly lowered the risk of heart attacks, heart failure, and strokes. Consequently, this study was widely used to promote stricter blood pressure control. However, upon closer examination, scientists realized that the SPRINT trial might not be entirely accurate. First, the study was primarily conducted on individuals with high cardiovascular risk, meaning its findings may not accurately reflect the effects of blood pressure reduction in individuals with low or moderate risk. Second, the blood pressure measurement method used in the study differed from standard clinical methods, potentially leading to variations in results. Moreover, the study did not fully assess the potential side effects of excessive blood pressure reduction, such as dizziness, fainting, or kidney impairment in elderly patients. These findings raise an important question. Should all patients aim for a blood pressure level below 120/80 mmHg? Or should we adopt a more personalized approach? Medical experts today tend to favor the latter, advocating for individualized blood pressure management rather than applying a one-size-fits-all target. This approach not only optimizes treatment effectiveness, but also minimizes unwanted risks. In conclusion, while blood pressure control is crucial in reducing the risk of cardiovascular disease, excessively lowering blood pressure is not always beneficial. New studies and trials, like SPRINT, have sparked a significant debate within the medical community about the best approach. Instead of blindly pursuing an ideal number, it may be time to take a more careful and case-by-case approach in developing the most suitable treatment strategies. In medicine, research plays a crucial role in determining the most effective treatment methods for patients. However, not all studies are entirely accurate or easy to interpret. One of the biggest challenges is how data is interpreted, particularly the concept of relative risk. This term is commonly used in research to compare the risk of disease or death between two different groups. For example, if a study claims that a certain medication can reduce the risk of stroke by 50%, many people might mistakenly believe that their personal risk of stroke will be cut in half. However, the reality is more complex. If a person's initial risk of stroke is only 2%, then a 50% reduction means their new risk is just 1%, a relatively small absolute change. This can make research findings misleading if they are not presented with proper context. Another issue arises when comparing patient groups with different blood pressure levels. A recent study examined two groups, one with blood pressure below 135/80 mmHg and another with blood pressure ranging from 140/160/0/100 mmHg. The results showed that the benefits of lowering blood pressure to extremely low levels were not as significant as many might expect. While the lower blood pressure group had a slightly reduced risk of cardiovascular disease, the difference was minimal when other factors, such as age, overall health status, and side effects of treatment, were taken into account. This raises an important question. Should everyone aim for a blood pressure level below 120/80 mmHg? Or should treatment be personalized based on each patient's specific condition? Medical experts are increasingly recognizing that not everyone needs to lower their blood pressure to extremely low levels, and in many cases, a reasonable blood pressure level may be sufficient to maintain health without causing unwanted side effects. In conclusion, medical research always has limitations and must be interpreted carefully. Concepts like relative risk can be misleading if not properly analyzed. At the same time, not everyone needs to lower their blood pressure to extreme levels, as the benefits of doing so remain unclear in many studies. The key is for doctors and patients to work together to find the most appropriate blood pressure management strategy for each individual case. High blood pressure is one of the leading causes of cardiovascular disease, stroke, and many other health issues. However, reducing blood pressure to extremely low levels, such as below 120/80 mmHg, does not always bring the expected benefits. In many cases, it can even lead to unwanted side effects such as dizziness, fatigue, impaired kidney function, and an increased risk of falls in the elderly. One key consideration is that blood pressure treatment guidelines are not solely based on medical research, but can also be influenced by political and financial factors. Pharmaceutical companies often fund research and aggressively promote blood pressure-lowering medications, leading both doctors and patients to believe that achieving extremely low blood pressure is ideal. However, this is not always necessary or beneficial for everyone. The important thing to remember is that not everyone needs to lower their blood pressure below 120/80 mmHg. For many individuals, a blood pressure range of 130, 140/80, 90 mmHg may still be acceptable without requiring excessive medication or drastic lifestyle changes. Blood pressure management should be personalized, taking into account factors such as age, medical history, and overall health status. So, what should patients do? First, they should thoroughly research medical studies and avoid blindly trusting one-sided information. Whenever new blood pressure guidelines are released, it's important to ask, does this research truly apply to me? Second, consulting medical professionals is crucial. Not just relying on a single doctor, but also seeking information from multiple sources for a more comprehensive perspective. Treatment decisions should be based on a careful balance between benefits and risks, rather than rigidly following standard numerical targets. In conclusion, while controlling blood pressure is essential for maintaining cardiovascular health, not everyone needs to lower it to the lowest possible level. Patients should remain cautious about treatment guidelines, be aware of the potential risks of excessive blood pressure reduction, and always consult with healthcare professionals before making decisions about the most suitable treatment approach.